With finals approaching, I thought it would be appropriate to talk about negative side effects of using Adderall and other stimulants to pull off all-nighters to stay for important tests or other serious academic tasks. Adderall contains a combination of amphetamine and dextroamphetamine, and it is used to treat attention deficit hyperactivity disorder, more commonly referred to as ADHD. Amphetamine and dextroamphetamine are central nervous system stimulants that affect chemicals in the brain and nerves, like the athlete who wants to improve his performance on the field through the use of legal steroids. The student who wants to raise his or her grades and sustainability is turning to the drug of Adderall. If taken as prescribed, the drug can enhance concentration, increase motivation, and provide a heightened level of alertness, and is designed to help those that struggle being able to concentrate and stay focused on daily tasks. However, the use of Adderall has become very common throughout college campuses. College students between the age of 18 and 22 are said to be twice as likely to use Adderall as non-students. The promise of a better GPA with less effort is motivation enough for college students across the board to obtain Adderall by any means necessary. Because so many have been prescribed the drug, access to it is fairly easy for those that do not have a prescription. It is stated that many students admit to actually seeing doctors and exaggerating symptoms of ADHD to acquire the medication. Others simply just buy a pill from a friend who is prescribed the medicine for the low price of around $3 to $5. However, there's many risks and side effects associated with the non-prescription use of Adderall. It has a very high potential for abuse and dependence. Most college students tend to take Adderall during times of high academic stress, such as studying for finals or writing an extensive research paper. Although it may help the student cram all the information needed to make a good grade on the test or help the student finish the paper faster, Adderall can have some serious side effects. Mark Stein, a clinical psychologist and director of the ADHD Clinical Research Program at the University of Illinois Chicago, states, the most common side effects are things like affecting your sleep, affecting your appetite, but they can also cause personality changes. There are also withdrawal effects when they wear off. People sometimes report that they're really tired or they're more moody or irritable. And then in rare cases, they can cause things like hallucinations. Other side effects include dry mouth and high blood pressure. More importantly, Adderall abuse can lead to Adderall addiction. Students who take the drug only occasionally eventually could find that they cannot function well without it. Dr. Raymond Kotwicki, assistant professor in the Department of Psychiatry at Emory University, is concerned about the psychological effects of the drug. He has concern for those students who already feel pressure to be perfect. He states, if you're a student and you feel you're not good enough to be able to do things without the aid of an external help, that's an idea that gets reinforced that can lead to a whole bunch of different problems. Not only does Adderall use have physical effects, but there are also legal and behavioral consequences. According to the United States Drug Enforcement Administration, drugs, substances, and certain chemicals fall under 5 different schedules or categories. Schedule 1 drugs are considered the most dangerous, and Schedule 5 drugs are the least dangerous. The DEA classifies Adderall as a Schedule 2 drug, which is defined as drugs with a high potential for abuse, with use potentially leading to severe psychological or physical dependence. Other Schedule 2 drugs include cocaine, methamphetamine, or oxycodone. I personally spoke to a student who admitted to using Adderall occasionally to help him study or take a test. He admitted that it did help him focus. However, he also admitted that you have to be very careful when taking it. While it does help you stay focused on a particular task, you may find yourself focusing on the wrong task. The student found himself in a ridiculous amount of time looking at Twitter on his phone instead of focusing on the material he intended to study. He also said that he would never use it to do math again. He had taken one before a math test and spent all of his time detailing every step of solving one math problem, but ran out of time before he could finish the test. A recent study from the University of Pennsylvania shows evidence that Adderall may not even work for those who do not actually have ADHD. The research team tested 47 subjects, all in their 20s, and all without a diagnosis of ADHD. Each subject was tested both while on Adderall and on a placebo in each condition. In each condition, the subjects did not know which kind of pill they were receiving. The researchers did come up with one significant finding. The last question they asked their subjects was, how and how much did the pill influence your performance on today's test? Those subjects who had been given Adderall were significantly more likely to report that the pill had caused them to do a better job on the tasks they've been given. Even though their performance did not show an improvement over that of those who had taken the placebo. Casey Schwartz states that it is not surprising that Adderall gave students an inflated sense of productivity. Schwartz writes, given that the drug, a close cousin of amphetamine, unleashes the feel-good neurotransmitter dopamine, which triggers the brain's reward systems and can produce a mild sense of euphoria, causing a state of intense excitement and happiness suggests that Adderall may only make studying more pleasurable. With this being said, if Adderall does not actually make one smarter, then why take it considering the negative side effects that come with it? Even if it makes you feel like studying is easier, you should not take Adderall if not diagnosed with ADHD. Once you get used to taking it for every test or last-minute paper, you may find yourself not being able to do anything without it. With finals coming up soon, I suggest that the best thing to do is just start studying earlier so you do not find yourself in a situation where you have to use stimulants such as Adderall. In the long run, you'll be much better off. Thank you for listening.